Hey there, and welcome to this screencast on blood pressure and blood volume. We're going to begin by taking a look at blood pressure and how we measure it, what our pulse is, and how it's affected, how we can get higher or lower blood pressure. And we're going to end with different scenarios where our blood volume, our blood pressure is lost, causing this to happen. So let's begin with a recap on exactly what blood pressure is. And blood pressure is literally the pounding of the blood on our artery walls. And we have a high pressure, a maximum pressure, and a minimum pressure. So we give them terms systolic and diastolic. For systolic pressure, that's going to be when our ventricles are contracting and at their highest amount of pressure exerted on the artery walls. And the diastolic is when they're filling and relaxed. And so a good ballpark range for this is about 110/70. Now, if you have a history of hypertension, of high blood pressure, although it doesn't seem very serious of a condition at that time, you still go about doing your normal things, but it's really a good indicator, a precursor of there could be something else very seriously wrong. And that's because if you're getting high blood pressure, usually what's happening is that those artery walls, which are really thick and muscular, they're actually narrowing because plaque and cholesterol is building up. So if this is all plaque and cholesterol, just like in a garden hose, if you have a smaller opening, the water, or in this case the blood, is going to go through at much higher pressures. And so what can happen is that because of those higher pressures in that narrowed artery, blood can start to work and loosen away the cholesterol, causing either a heart attack if that blockage happens in your heart. It could be a stroke if it happens in your brain, or it could be a severe blood clot if it happens somewhere else. So high blood pressure is really an indicator that something else more severe could be happening down the road. Now, how do doctors actually measure this when you go into their office? Well, essentially what they're going to do is they're going to listen for the starting and stopping of blood pounding on your artery walls. So what do they do when they put that cuff on and they really rank up the pressure above 120, is they're cutting off blood flow at the brachial artery. So what they do is they pump it up really high, and as they slowly lower it down, 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 they're listening for when the sounds, the beating sounds, begin. And that's going to be your high pressure, your systolic pressure. And as they keep lowering the pressure slowly and slowly and slowly, those sounds will begin to stop. And as soon as they stop, oops, I'm over here. As soon as they stop, they will record that as the diastolic pressure, and that's when blood flow resumes in that artery. So they cut it off and they listen for the starting and stopping of sounds correlating to the systolic over the diastolic pressure. And they do that using a machine called a sphygmomanometer. Go and practice that one in your bedroom at home. Now, there are a lot of things that can influence blood pressure, but I just want to show you a couple today. And they're actually pretty easy because if you increase all of them, how much blood you have, how strong your heart contracts, how fast your heart beats and your pulse, or how thick your blood is, those are all going to raise your blood pressure. But fortunately, we can give and control blood pressure through medicine really well. For example, we can put you on blood thinners to decrease your blood viscosity. We can put you on medications that slow down your heart rate and your pulse. So just right there off the bat, we can do a lot of things medicinally to control blood pressure so that those later things down the road don't happen. And then very closely related to blood pressure is our pulse. Now, our pulse is not measuring the pressure at which the blood pushes against the artery walls, but just how many times a minute it does that. And so you can measure pulse obviously in the pictures here in your carotid artery or in your radial artery in your wrists, but there are actually a lot of places around your body where there's a strong pulse through those arteries near the surface of the skin. For example, there's actually one in your armpit. There's one called the popliteal artery behind your knee, etc. So there's lots of different places, but those are usually the most easily accessible ones. And you want to get about 60 to 75 beats per minute, or 60 to 75 times blood pulses against the artery walls. Now, the last thing I want to finish up with is circulatory shock, when our circulatory system cannot do its job of delivering oxygen. And that happens in a pretty short amount of time. Our brain can't go a very long time without any oxygen, just as much as any other organ. So there are a couple of different ways that this can happen. The first type of shock is cardiogenic shock. So I'm going to draw a little picture of a heart here. This is basically when our heart fails and it cannot do its job, which is to pump oxygen throughout our body. The second type of shock is hypovolemic. So I'm going to draw little drops of blood. This is severe blood loss. So say someone was in a car accident and they have hypovolemic shock. That means they've lost lots and lots of blood, so the blood cannot get oxygen to the rest of the body. For neurogenic, I'm going to draw a little lightning bolt. And this is because your autonomic nervous system is not communicating properly with your blood vessels. Now remember, your blood vessels, the diameter of the blood vessels, will draw a thick artery wall again, are controlled by this. And so what happens in neurogenic shock is that the autonomic nervous system is making them dilate. And so then you have a severe drop in blood pressure, and blood cannot deliver oxygen. All right, the last two down here is anaphylactic, and I'm going to draw a little, this will be a peanut. This is a severe allergic reaction that can result in circulatory shock. And then the last one I'm going to draw is a little bacterium, little flagellum there. And septic shock is when bacterial toxins are released from bacteria and they literally poison the blood so it cannot do its job. So let's look at blood pressure, let's look at pulse, and finally the different avenues of circulatory shock.